All right. Hello, everyone, and welcome to today's CSIMS Zoominar session. Please be sure to answer the questions on your screen before we start today's session with Dr. Patel. I just have a few quick reminders for you all per usual. If you haven't yet heard, CSIMS 37th Annual Conference is only 2 months away, which is scaring me because the year is flying by, but we hope to see you all there. It is a workers' compensation conference, and it is on October 20th through the 23rd at the Lowe's Coronado Bay in San Diego. I'll be sure to link more information in the chat box momentarily. In addition, we do have limited booth space left, and sponsorships are now available. So if you are interested, please be sure to reach out before they're all sold out. And then during this session, please be sure to utilize the Q&A and chat box so we can have an interactive session. And my final reminder, I promise, before passing off to Dr. Patel, is that the recordings and materials to this session will be made available to CSIMS members only. So if you're not yet a member, you can join us at csims.org. And again, I promise not to talk your ear off. I will link more information in the chat box momentarily. And with that, I will pass it off to Dr. Patel for today's session. And I'm sorry, actually, before I pass it off, someone just put in the chat box, our staff is so excited for today's session, got 15 people in the lunchroom. So that's efficient use of a Zoom account. You pay for one and you get 15 people at once. I give them props for that, but we're excited as well. So thank you so much for being here, Dr. Patel. And yeah, take it away.
Well, thank you so much for that introduction. I'm going to start sharing my screen. Can you guys just confirm? You see some fancy drapes? Is that what you guys see?
Perfect. The show's about to begin.
Yeah, excellent. I got 3 monitors, so sometimes I get very confused as to what the heck I'm sharing. I promise you all my naughty windows are turned off anyway. So thank you everyone for taking your Tuesday lunch to join me with talking about avoiding case killers and how to avoid them by preventing gaps in treatment. I'll tell you a little bit about myself in a couple of slides, but I wanted to just first thank CSIMS for inviting me out to present on this topic that it's like the elephant in the room. You guys all know about it. Everyone knows that you're not supposed to have gaps in treatment, but a lot of times it gets overlooked by other pressing matters that calls everyone's attention. It doesn't matter if you are a personal injury law firm, a workers' comp law firm, or any type of healthcare provider. You could be a MRI facility, you could be a chiropractor, orthopedic surgeon, doesn't really matter. Everyone that I just mentioned will be negatively affected if they have a client that experiences a gap in treatment. And so I'm a managing partner of Compliant Clients, and I'm going to focus on how to prevent gaps in treatment and how it can improve your case outcomes. So while this whole presentation is based around personal injury, because that is the industry I exclusively focus in, you can still take a lot of learning points away and apply it to the rest of your practice, whether it's workers' comp or seeing insured patients as well. So 2 ways that you can prevent gaps in treatment is to focus on confirming your clients have access to transportation so they can get to and from their medical appointments, and as well as they have access to their injury-related medications. So those are the 2 areas that we're going to be focusing on. So what are you really going to learn from this? I don't think I'll be able to talk your ear off for an hour. As much as I like to hear myself talk, I don't think I have that much content, so I'll spare you guys. But these 6 questions, you should get the answer to. So how or why you should care about gaps in treatment, how many people are really affected by this gaps in treatment, how to prevent them, what are some no-show tactics, and how does insurance companies' evaluation software, how do they take into account when you do have a client that has a gap in treatment? What are some of the main questions, whether you're a law firm or a healthcare provider, what questions do you have, and what you should do differently starting today. So a lot of times people hear webinars and presentations are like, oh, wow, that's really cool. I learned something, but then 5 minutes after this webinar, you got to go back to work. You got to go back and do your main job, and you might forget what was the actionable takeaway. I will condense that down into 2 slides. 1 slide if you're a law firm, and 1 slide if you're a healthcare provider. So those are the questions that this presentation will answer.
And Dr. Patel, I'm sorry, yeah. We already have a question, and I just figured it could be one
yeah, sure.
Just kind of preface it.
Let's do it.
So it reads, who should be responsible for making sure the patient gets transportation, the attorney or the physician or doctor?
It is everyone's responsibility. And I'll tell you why a little bit later. I mean, I could tell you why right now, but then that's just kind of skipping around.
But now we know that the longer answer is coming. So
yeah, the longer answer is coming. The too long didn't read TLDR is everyone. Long answer TBD or to come soon. So let's talk about why you should even care, why this hyper Indian doctor, why you should even listen to him. Why I'm a pharmacist. I'm a doctor of pharmacy. I live in Austin, Texas, born and raised in Houston. My wife's son and I live in Austin. You might be wondering, what the heck is a pharmacist doing in CSIMS presenting to attorneys and law firms? I'm sorry, attorneys and healthcare providers. How did I even end up in PI? The short answer is in 2018, I was trying to figure out who else could benefit from my pharmacies. I own a couple of pharmacies in Texas, and I was thinking about what other populations can we serve? Who else needs access to prescriptions? I got connected to some personal injury attorneys in Austin, and they asked me if I could provide my services on lien on a non-recourse basis. And I was like, yeah, for sure. And I asked them, what else do you guys need help in? Like, what else can I do? I really want to learn more about this space. I was very green back then. I didn't really know much about it. And one of the areas that they asked was that they needed help in was like, hey, we have a lot of clients that are like missing their appointments. What can you do about that? And I was like, I don't know, like I can call them a Lyft or an Uber, much like you can, but you know, let's just see where it goes. So what I did back then was I started calling Lyfts and Ubers. I didn't have a case manager. I didn't have investor funds. I just kind of worked myself. I even gave people rides when Lyft and Uber couldn't pick them up because they were too far, or if they needed wheelchair accessible transportation. I kind of went above and beyond to make sure people made their appointments. And I did it all under lien. And I did it for quite a while, maybe like 6-7 months just by myself, just trying to see, hey, does this work? Is this really helping improve case outcomes? Is this a needed service? If it's just happening very, very rarely, then I probably don't need to do this too often. But lo and behold, I found out that this is a very much needed service, and this is a problem. Doesn't matter where you are. Not all of your clients, most of your clients may have a ride. Most of your clients can't afford medication coverage, but there's a lot of people that are slipping through the cracks. And that's why I founded Compliant Clients a couple of years ago, just to address those gaps in treatment. So, and I'm not just a provider, as you can tell in that that screenshot you have there. I do focus a lot of my time, or not a lot, some of my time, testifying in support of litigants' rights. And that's just me at the Texas Capitol on a committee hearing testifying there. So I do spend my time at Compliant Clients making sure doctors and law firms across the nation know that they have transportation and pharmacy access on lien. I'm also the managing partner and chief practice development officer of a traumatic stress injury services company called MediMental Care. So I would like to say I'm pretty knee deep into personal injury at this point, and I look forward to educating the masses about how we can be of assistance to their personal injury population. So, oops, I think I went backwards here. So why does this matter? Again, you guys, everyone knows that, maybe we should focus on gaps in treatment, but what is the real outcome here when there is a gap in treatment? It's pretty straightforward. If you have a gap in treatment, you're going to get a low settlement offers. Juries rarely award high damages if they can see that a client got into an accident today and they didn't go to the doctor for 5 days, or even if they went to the doctor immediately and the doctor told them, hey, you need to go see physical therapy or go to a chiropractor 3 times a week, or you need to see a neurosurgeon for follow-up. Doesn't matter. If they're not staying adherent to their prescribed treatment plan, the jury is going to smell that BS from a mile away. They're going to be like, hey, how much pain is this guy really in? Clearly, it's not that big of a deal for them to miss these appointments. So I don't think they should be awarded this $5 million, punitive damage settlement. And this is still the case, even if the person tries to rectify it a month later. So the damage is already done in the beginning. If you don't fix this or prevent this in the beginning and you just try and make up for it later on, the damage is pretty much done. And the defense knows this as well. So the best advice I can have on this call, or I can give in the very beginning, is just prevent it. Don't even let it happen in the first place. And we'll talk about how. So how many people are missing rides due to medical appointments? Quite a bit. Millions of Americans are missing it due to lack of transportation. This is a little bit less of a case where you have a reliable public transportation options, but where I live in Texas, if you don't have a car, you're SOL. I would like to say that's the case in California as well, since California is our second biggest state where we get business in. Florida, Georgia, Arizona, Nevada, New York, or to name a few other states that we do work in as well. These stats I actually got today. I was updating this slide deck to be like, hey, what else can I educate these people on when it comes to more recent stats. This came out on New York Times. New York Times published an article today. They were saying U.S. Traffic deaths are rising. And that's kind of interesting, because you might be thinking, well, like, hey, why are deaths rising? Cars are getting safer. Electric vehicles and their self-driving capabilities are going on. There's less people on the roads. This doesn't really make sense, does it? No, it's actually because of quite a few factors. And it's because stress, anxiety, and anger, literally probably mostly just due to COVID, are causing people to act more dangerously when on the road. And it's actually much more common in lower income neighborhoods. And you might be wondering why. Well, there's a lot of socioeconomic differences in vehicle quality, road conditions, a lot more substance abuse there, and the availability of crosswalks. So a lot more traffic deaths are happening in poorer areas of our country. And a lot of essential workers who couldn't stay home and work remotely, like me, I'm at home right now, they're disproportionately made up by lower income demographics. So unfortunately, because of that, the traffic deaths have gone up. And it's getting, I'm sorry, here's another vehicle death graph that we have here. The last 2 years, it's been going up. Traditionally, from 1960 till now, it's actually gone down, thanks to a lot of safety precautions and rule updates that's been happening in the automotive market to make the cars safer. Stress, anger, and anxiety have more than made up for the increase in aggressive driving across the nation. Alcohol and drug abuse increased due to COVID. I'll read a quote to you here. The US DOT reported that the proportion of drivers testing positive for opioids nearly doubled. I'm going to say that again. The proportion of drivers testing positive for opioids nearly doubled after mid-March 2020 compared to the previous 6 months, while marijuana prevalence increased by about 50%. And mid-March 2020, just to jog everyone's memory, that's around when the major COVID mitigations began. So all these people missing appointments, what does it mean for a healthcare provider perspective? It's a pretty big deal. Attrition. If you have one person missing their first appointment, they're already about 18% more likely not to even attend another appointment again. If they miss one or more appointments, you're at 31%. So from a healthcare provider perspective, it doesn't matter what type of healthcare provider you are, you need to prevent it. Otherwise, you could possibly lose that patient forever. Why are personal injury patients missing appointments? Lots of reasons here. Here are the top 5 that we see. A lot of times they have a secondary car at home. It's just that car is being used by another family member. Maybe the other family member is taking their kids around, or maybe that family member needs it for work and they just don't have another car at home. Or maybe they're unable to work due to the injury, so they just have financial hardship affording gas prices. Maybe they have a car at home that they could use, but it's just too expensive for them to be driving around and taking care of their appointments and things like that when they have other pressing matters to tend to. A lot of times, depending on where our clients live, the distance of the ride to a clinic can be a big turnoff, because if they're in the sticks in Texas and they have to go see a specialist 40 miles away, that's 80 miles round trip. That's a decent amount for gas money. And while many people can afford it, there's also an increasing amount of people that can't afford the gas for that type of trip, especially if it's multiple times a week or multiple times in a month. It's really adding up for a lot of people. And the last 2 reasons, again, the top ones, very prevalent for us in Texas, just lack of public transportation options. And then the last one, sometimes you need a special type of car. So they might have a car at home that they can use, but maybe because of the nature of their injury, they can't drive and they need some hand-holding or assistance to take them to that appointment. Sometimes they need someone to wait with them at that appointment because they need a responsible individual to take them home. So even if they could drive there, they don't have anyone to take them home. And that's obviously causing issues when trying to be adherent to your care plan. So from a legal perspective, how common are missed appointments in PI cases? Very. You're not going to find an official, report on PubMed or, Westlaw. Go to Thomson Reuters and look for some official case law on it. But literally do a Boolean Google search on missed appointments and then type in law firm. You're going to see that lots of law firms already have articles and blog posts on it. They're all telling their clients, don't miss your medical appointments. Make sure you attend to them because it can help document your pain and suffering, and it will help you in recovering what is rightfully owed to you. Besides that, we've been doing it for 4 years. We have over 2,000 cases that prove, hey, this is a thing and people really need it. Not everyone, but some people. This is a mouthful in this slide. I'm not going to read through it all. There'll be a copy of this, in the presentation, but there's lots of things that a healthcare provider can do to prevent no-show tactics. It's not just about transportation. It's not just about pharmacy. It's also about how you run your practice. And depending on how you run your practice and how efficient you are, you can use all or some of these types of tips on this slide to help you prevent no-shows. So even though the majority of my focus is always on transportation and or pharmacy, it's always helpful to have some other type of no-show tactics offered to whoever I'm speaking with. So at the end of the day, you want to make sure you give your patients choices. So that way there's a good chance they're going to show up. So beyond the dollar, we've just been focusing on, damages in your cases, having a less than optimal outcome. But as doctors first, we all took an oath, and that is to do no harm. So we need to always focus on the clinical perspective. It doesn't take a rocket scientist to understand that patients not showing up to their appointments, it's going to turn into a delayed in their outcome and healing. So what is transportation's role in healthcare access? I've pretty much, beaten this to death already, but you can understand that when you have a clinician visit that they make due to having reliable transportation and they're getting their medications and treatments on time, it always, not always, but usually it will translate into improved health outcomes. And so making sure that your clients have reliable transportation and access to any type of treatment, medication or otherwise, it's really imperative upon us to make sure all of our clients have it. And did you know, this is one of my favorite slides for law firms, because law firms are not really aware of this. They think that transportation is not compensable, that it's not recoverable in a personal injury space. They are correct if they provide it. If a funding company provides it, same thing. If a funding company or an attorney provides it, they are not, or they shouldn't probably introduce that to the case as a medical bill, because all the defense is going to say is, hey, Mr. or Miss Attorney, or hey, Mr. or Miss Funding Company, you guys are directing medical care. You're going so far as to schedule and pay for rides for your clients so they can obtain medically unnecessary treatment. Of course, that's going to hurt their case. Whereas when you outsource it to a third-party provider like ourselves or anyone else that focuses on medical-related transportation only, it is a compensable expense. It is recoverable. It's just as valid as an orthopedic bill or a pain doctor's bill or a chiropractic bill. And it is included in medical damages. And of course, it helps document pain and suffering. And again, the transportation, you might be thinking, well, can they get a ride anywhere? No, we only provide transportation related to the injury. We don't take them to the bar. We don't take them to run errands. It's only related to an appointment related to the injury. And we're not going to, same thing with like pharmacy medications. It's not like we cover a cholesterol medication unless that's somehow tied to the case at hand, but only medications that are covered are something that is related to the injury. So switching gears, now we've talked a little about transportation statistics. I'd like to talk a little bit about pharmacy statistics. And we actually have a couple of drug examples at the end of the next couple of slides. So drugs increase every year. Drug costs increase every year. I've been owning pharmacies, I think 7 years now. I own multiple pharmacies every single year. The same drug that's been generic for 30 years, it just increases every single year. They outpaces inflation. Everyone says like inflation is crazy right now. Well, drug prices probably beat inflation by like 5 times the amount. Up to 40% now of Americans are struggling to pay for the cost of their medications, even though mostly everyone has prescription coverage. You might be wondering, like, why is that? It's because high copays, deductibles, donut holes, gaps, all that sort of stuff that you guys are familiar with on the health insurance side. It's just as visible on the pharmaceutical side, unfortunately. And a lot of people get trapped with whether they need to make the decision onto whether they should be paying for their medications or paying for rent or paying for something else that is equally as important to them. And so a lot of people are just skipping medication costs at this point because of that. I'm not really sure why it's zooming in here, but it's saying that around 18% of the people have been having to pay a little bit more, and out-of-pocket expenses are rising, and increased copays are rising as well. So what is the takeaway of this? This one's also saying 18% have had trouble paying for basic necessities like food and housing due to the cost of their medication. your main takeaway is that medication costs are rising. And now you might be thinking, well, I'm not the one writing the medication. Maybe you are. If you're on this call, maybe you're not. Doesn't matter if you're the one writing the medication or the one, if you're just involved in the client's case. If your client is not taking medications and you're involved in the case, you're a downstream provider, yes, but it still affects you, because if they're not taking their medications, well, that's going to result in a gap in treatment, and it's going to result probably in a larger than appreciated reduction request at the end of the case, because the case got damaged. So everyone is affected, no matter who you are, whether it's your appointment. If your client is making your appointment but missing someone else's, well, it's going to come back and negatively affect you anyways. Same thing with pharmacy. If you're not the one writing the prescription, but your client is not taking the medication that some other doctor wrote, whether it was because it was too expensive or it might have been cheap, but they just didn't have a ride to the pharmacy to pick it up, it comes back and affects you anyways. Here are 3 drug prices I wanted to just talk about. Just on GoodRx, it's like, let's just talk about some common ones and not common ones. Flexeril, it's a muscle relaxer, generic name cyclobenzaprine. This is probably our #1 medication we dispense. It's fairly cheap. Even GoodRx has it for like 10, 11 bucks. This is not one of the meds that, most people need help with, but honestly, this is our #1 drug that we cover. It's written quite often, not that expensive. Luckily, this drug has not gone up very much every single year. Honestly, this drug actually was cheaper last year, but it's still relatively affordable. There are other drugs that are, of course, not this affordable. Dronabinol is a medication that's used for nausea. This medication, even with GoodRx, you can see it's quite expensive. It's anywhere from $100 to $180 going to one of your main retailers, and that's just for a 30-day supply. And here's one that's been trending recently, Botox. It's not just used for what you guys think it's used. In 2010, FDA approved it for preventing chronic migraine headaches. It's a botulinum toxin A, it's a neuromuscular blocker, and this is crazy expensive. You might be thinking, oh my God, what's the markup on this? To buy that drug, so speaking from a pharmacy perspective, it's still 4 figures for me just to buy that drug. So it's not like I'm buying it for $300, charging $1,200. For me to buy it, I haven't checked the price in a couple of weeks, it's still over $1,000 for me to buy anyways. So it really depends on what the doctor's writing on, whether it's going to be affordable or not. But even if you had this Flexeril drug and the doctor wrote it, if somebody doesn't have insurance, maybe they can use GoodRx. Some people, they have insurance and their copay is higher than the GoodRx. So that just kind of shows you, how potentially broken our healthcare system is. At the end of the day, it doesn't matter if it's a cheap drug like this or an expensive drug like this. If somebody's not taking the drug that was prescribed to them related to their injury, it affects all stakeholders. Doesn't matter if you're the client, the doctor, the law firm, or any other ancillary provider. It comes back to hurt us all. Switching gears now to insurance adjustment software. By no means am I an expert in this. Honestly, all of these top 4 claims companies that have their software, it's all patented data. It's not like you can figure out what questions they're asking and things like that. I just did a little bit of Google searching, honestly, and transparently, just to kind of understand where they're coming from. So for those of you who aren't aware, I could at least give you a bird's eye view of what these programs are and what they do. So for those of you that are aware, and probably any law firm that's attending this call, you're painfully aware of what these 4 do. You can just disregard me for the next 2 minutes. For everyone else, these softwares are the ones that State Farm and Allstate and other insurance companies use, and their adjusters use to input case details about. And they put all these inputs in, and their software spits out what they think the recommended settlement amount is. And where I'm getting with this is what is in our control as a law firm, as a healthcare provider, as a legal service provider like myself. What is in our control, considering that law firms, defense companies and insurance companies using these insurance adjuster softwares is not in our control. So these are some sample factors that are taken into consideration. There's like hundreds, if not thousands of factors that take into consideration, but the first 2 that I named here, I would think that is in our control somewhat. Gaps in treatment and duration of treatment. Duration of treatment really depends on the healthcare provider and what they deem medically necessary. Gaps in treatment is something I believe is not completely preventable, but we can do our best to prevent it in the first place. There's always hundreds of other value drivers that may not be, taken into consideration. Here are some factors that are not taken into consideration. It's really hard to document or maybe not document, it's really hard to put into a software the extent of a client's pain and suffering, how long they were in pain and suffering, and how the client was able or unable to get back to work and carry on with their life. And of course, that's like an eternal struggle, whether you're on the defense side or the plaintiff side, to how to fairly and accurately value the value of a case. And here are other factors that are not taken into consideration when you're putting all these factors into the insurance adjustment software. And it's really tough because one person, let's just say you have a tennis player who had a tennis injury versus someone who isn't a tennis player, had an elbow injury. Obviously, you're going to have a lot more emotional stress and trauma to the person who was a tennis player. But how do you quantify that? The software doesn't really take into consideration that example that relates to the second bullet point in this slide. And of course, loss of consortium isn't taken into consideration as well. One of the many things that's not taken into consideration. So again, what is in your control? Documenting pain and suffering and preventing gaps and delays in treatment to the best of your ability. Those are two things that we can focus on, or everyone should focus on when having a case that's in the personal injury space. And this is an example of what may happen when you have a case that is, without transportation or pharmacy support. They start missing appointments and they don't take prescribed medications, and you find out a little too late. You find out people are missing their appointments. Well, then you go and get them in and scheduled, but the damage has already been done. There's already a gap. And the defense is going to see that, and they're going to use that to devalue your case, and you're probably going to be forced to settle for a suboptimal outcome. Whereas if you do make sure that your clients have transportation and pharmacy support, hopefully and theoretically, they will, the length of the case is going to be much shorter because they got the treatment that they needed as soon as possible. They were able to obtain the medications they needed and were they were compliant with their care plan, and hopefully that translated into what we all want, which is improved health outcomes. So again, scheduling rides and missed medical treatments, it costs everyone their time, their money, and at worst, their case. And so what we all should be doing is focusing on a couple of different areas. That, hey, let's prevent gaps in our clients' treatment, make sure they get to their appointments. And this is a team effort, right? So you might be thinking, well, I work at an MRI facility. I'm only going to see the patient once. I'm going to see them for imaging because I got the order from the chiropractor. What else can I do with this, Dr. Patel? The rest is not really in my hands. True, it's not. You can't really, force. You're not really seeing that patient get seen everywhere else. But you can always let the client know of whatever you have that's in your arsenal to help them recover faster. So whether it be asking your client, like, hey, if you need a ride to your doctor's office and you're about to miss an appointment, go call your attorney. Let them know so they can arrange something for you. Or hey, if you're having trouble affording anything, talk to your attorney. They'll figure something out for you. They should figure something out for you, or kick them my way, or figure something out. At the end of the day, you do have what it takes to help your client when they're not just in your medical office or your law firm. And of course, partnering with the right people to help improve your credibility and for healthcare providers specifically, be a resource to your law firms. If you're able to help them with the case outside of just exactly what you're doing in your procedure or in your patient room, that goes a really long way, because it shows to your law firms and it just shows to everyone else that you're a team player and you want to help out your client as best you can. So we already touched on this. I just wanted to focus on it again, that law firms and funding companies, they should not be the ones, I don't think, scheduling rides. Some healthcare providers, they schedule rides too, and that's okay. Some healthcare providers that I even work with themselves, they're like, hey, we prefer to schedule rides just so, because we don't mind paying for that cost. And I'm like, hey, by all means, go for it. It just means you have to tie up your own funds, and your own team is going to have to spend time scheduling those rides. And then unfortunately, when people miss their rides, well, guess who they're going to call? So, healthcare providers, they can schedule the rides themselves. They can choose to, or you can choose to outsource it because it's no cost to you anyways. But at the end of the day, the biggest thing is if a law firm or a medical provider does it, it's a non-recoverable, non-compensable case cost. And it's honestly a form of like plaintiff advancing, which a lot of states look on as unethical, versus if you have a healthcare provider do it or a medical service company like us do it, it translates into something that's recoverable and is compensable because it is a medical bill. So we are wrapping up, actually. So that's not too bad. We're 35 minutes in. So what change do you need to make right now? Here are those two slides. And again, it will be in the slide deck that's going to be saved and uploaded on the CSIMS website. So if you are a healthcare provider, if you work at a healthcare provider's office, 3 questions that is easy for you guys to include as soon as you know, whether it's a workers' comp patient, a personal injury patient, or a healthcare, private health insurance patient. Why not ask these questions? Just because I'm only in the personal injury space doesn't mean these aren't great questions to ask. Ask your potential client. Do they have transportation to and from your appointments or others? Do they have prescription insurance? And even if they do, don't assume they can afford their copays and deductibles, because you never know what's going on. Like, for example, I'm on a specialty med myself. Whenever I get in the donut hole, that thing costs you like $500. And I have like PPO, like, pretty nice insurance here, but it's still very expensive for me. And you never know what situation that your patient is in. So just because they have prescription insurance, don't always assume that that's enough for them. And they might appreciate some other alternatives that you may have. These questions are if you're in a law firm. A law firm case intake is very vital to figure out not just if the case is worth taking, but also even if it is a great case worth taking, liability is clear, commercial policy is there. It doesn't matter if your clients are missing their appointments. Ask these questions. Ask them if they need a ride. Ask them if they need help getting their medications covered. They're coming to you to help them with their case. Don't limit it just to things, just to your legal, purview. You can always try and help over on the medical side without directing medical care. Because at this point, you're just trying to be helpful. You're just trying to make sure they make it to their appointments. You're trying to make sure that they have access to their prescription medications if they need them. And if anyone asks you, like, hey, did you force it on your client to use this? You're like, no, I asked them if they had a ride. If they didn't have a ride, so I recommended we use this company, or we did something else for it. Same thing with medications. You're asking them to be helpful because you're trying to prevent gaps in treatment. If you guys obviously need more information mailed to you, we're always happy to mail you business cards and flyers and things like that. So that's not an issue there. I would love to answer any questions that anyone had on this presentation. I know I sped through it quite quickly. I had 3 cups of coffee today, so I stole my wife's coffee. She said she didn't like it, so I heard hers in addition to mine. But I did want to make sure that I didn't, talk everyone's ear off too much, but I also wanted to make sure I have room and time for everyone to ask their questions for me. So with that, I'll stop sharing my screen and open it up.
Yeah, so the first question is, in California, most medications aren't approved, and they said specifically in work comp. Do you have any experience with transportation getting approved in California for work comp?
Yeah, great question. I don't do any workers' comp. So this is a great for me, not great for you answer. I don't do it. I do know a couple companies that have, I'm sorry, not a couple companies, a couple of law firms in California that are currently looking into this for me. Because they said the same thing. They're like, hey, Dr. Patel, we're using you for personal injury. Can we also use you for workers' comp? And I'm like, well, unfortunately, my software is only built to offer our services under lien after the law firm creates an account and enrolls clients. I'm not really sure how that workers' comp space works. So put it this way, if you find out that it is covered, feel free to reach out to me. I'm sure we might be able to build something out and address those clients that way. But at least for me specifically, we only work in the personal injury space under lien nationwide.
Yeah, well, I can say that it's probably would be very hard to get anything approved because everything gets denied in work comp, specifically in California. Like it's honestly, it's crazy, but that's also, the whole CSIMS thing is just educating people more and having them be more aware and how to be smarter in it because the system is beyond broken. So I'll save you from that one. Don't do that in California and for work comp because it's too much. So the next question is, how do you feel about that Shark Tank guy's new online pharmacy? I'm assuming they mean Mark Cuban's new online, like lower price. I forget the name of it.
I forgot it too, but you know what? I think anyone bringing transparency into, personally speaking, one of the most shadiest industries in the US, which is pharmaceuticals, not pharmacy. Pharmacy, I kid you not, pharmacy is not, there are bad pharmacies. I'll tell you, but put it there. There's always bad apples in every industry, but the amount of shrouded, or the amount of shroud and grayness in pharmaceutical pricing, there needs to be transparency there. And I think that's a great step in in the right direction. And I really hope something positive comes out of it. So honestly, I'm all for that. I'm all for anyone trying to take away the veil that a lot of big companies hide behind. And I think it needs to be a fair playground for everyone, to provide services in, because it's just a very backward system. or it
Oh,
is.
absolutely. I did look it up. It is called the Cost Plus Drug Company. And I mean, it's crazy. On the first page, it says the retail price. I'm going to absolutely butcher this name. Imatinib? Imatinib?
Oh, imatinib. Yeah, yeah.
Yeah, I
Imatinib.
guess it typically retails for $2,500 and they have it available for $14. That's crazy.
I'll tell you right now that since we have time, since I spoke so fast, now we get to do some education on what I really know. I know transportation, but I went to school for pharmacy, right? And now I own multiple pharmacies. I like to explain how drug prices are, the drug price industry, and something that's relatable for the general public. So let's just say you go to the Ford dealership and you want a Ford F-150. So you want a Ford F-150. The MSRP on this car, Ford F-150 Raptor Edition or whatever the hell they have right now, $60,000. When you go to talk to the car salesman, you're not about to pay $60,000, right? That's MSRP. You got to do a little bit of negotiating. Or if you're Indian, a lot of negotiating. I would negotiate that down to 30,000. I'm sure I'll try my best. But the moral of the story is you didn't pay MSRP. You didn't pay that list price. You paid something negotiated. Drugs are the exact same way. The MSRP, or they call it the SWP, which is called the suggested wholesale price. What was that you said for the imatinib? 2,500?
2,500, yes.
That is the MSRP. So the MSRP of the Ford F-150 being 60,000. That is the MSRP. They call it SWP, suggested wholesale price of the drug. That much. And the list price is what pharmacies buy it for, or maybe what it's sold for to the wholesaler. Then they mark it up a little bit so mom and pop pharmacies like me can buy it from them. The list price is something that you just said. You might be wondering then, who is making anyone charge the MSRP? A lot of times you're bound by contractual obligations to charge that. A lot of times you're not, but a lot of times the payment is structured around that. A lot of times these insurance companies, they contract with pharmacies saying, we are going to pay you the SWP minus 85%. So whatever the SWP was, which was $2,500, minus 85% of that. So they're only paying us 15% of it. So there still is margin on it. But you can probably see at the end of the day, the crux of the problem is, why is there such a big difference between the buying price of a pharmacy buying the drug versus this artificially inflated for no good reason MSRP? And the whole industry has been based around paying off a percentage of that list price. So there's a lot of overhauling that needs to occur. Nothing I say in the Zoom webinar is going to make it all right, but I just kind of at least wanted to shed some light in terms of like, how is Mark Cuban's company doing this? Is because they're just being a lot more transparent about that buying price. And I applaud that. I think a lot of us could learn from that.
Yeah, absolutely. And to go off of that with your expertise, one of the questions actually says, how can one tell if someone's a shady pharmacist? Never heard that side before. It's true. You always hear about like, oh, the shady lawyers, the shady like doctors, but I guess you never, I don't know. I guess I've never thought about it either.
So there's a couple of different governmental websites. Like OIG, I forgot what they're called, Office of Inspector General, DOJ. They're always, not always, but if they're doing the job, they're usually posting something about who they found that was doing something fraudulent. A lot of times pharmacies are involved in that, whether it's due to anti-kickback statute scheme violations, Stark law violations, violating something egregiously, a lot of times you can see them published there, but kind of like any other profession, how do you, there's not exactly some directory that we can go to be like, hey, that guy's shady and hey, that guy's not. So I wish I had a better answer for that. But definitely pharmacies are definitely involved. They're sometimes they're culprits to a lot of shady tactics.
Yeah, and I guess to go off of that, I mean, how from your personal experience, like if you're going into a pharmacy or dealing with a pharmacist, maybe they haven't made it into that big blacklist yet or anything.
Yeah.
Is there any like red flags that patients or even prescribers should look out for?
Well, I mean, that's actually a pretty loaded question, but I would probably say it's like, maybe trust your gut. Do you feel like you're getting a good vibe from the person you're talking to? Does it seem like they're authentic and trustworthy? Because honestly, sometimes, how can any layman really do a lot of due diligence on any company? You can go check their whatever governmental board that they're a part of. You can try and go on LinkedIn, but there's not too much data that's really out there. Google searching is a good place, but it's honestly how would you validate or try and look up the authenticity of any company? Do what you would normally do anyways.
That
Go
is,
off of word of mouth referrals. I mean, that's what I do with my doctors. Even with my family, even though I know a lot of doctors, I just go off of word of mouth referrals. Like who should we see, or who should my son see, or it's just go with who you trust. That's my personal advice.
yeah, no, absolutely. And then another question is, what do you recommend doing in situations where the doctors and lawyers don't communicate well for one reason or another, but neither has figured out transportation? And then they followed up with, or even better, what happens when either side points the finger at one another and still nothing is done?
We talking about marriage? Or we talking about work at this point? So honestly, that's the best time when a lot of times we prevent that. I'm not going to just toot my own horn, but communication, it's key. Doesn't matter whether it's your personal life or professional life. It's a lot of it just depends on communication. And it's really hard because especially with communication with two entities that are insanely busy, healthcare providers have so much on their plate. And unfortunately, half the work is like a lot of it's administrative. And same thing on the legal side. And when I'm doing legal, with some law firms, I just like to audit their operational efficiency, just because over time I've just become familiar with what works and what doesn't after working with hundreds of law firms. Everyone's so busy. Everyone's so busy with a lot of stuff that is not even or shouldn't have to be a part of their day. And that's what's really taking away from everyone's time and things like that. And the last thing you have time for then is communicating with the third party, because just because you're ready to communicate with them doesn't mean they're ready. So a lot of times you have to, not saying build a workflow or do this or do that. Sometimes the best thing to do is just outsource it. So something as simple as like pharmacy or transportation or something like that, whether it's us, there's like lots of other case management companies, medical record retrieval companies there. That's why it's important for everyone just to focus on building out your network to help you like decrease the amount of administrative overhead that you have to deal with. Doesn't matter if you're, again, a healthcare provider, you don't have to do everything in-house. It doesn't matter if you're a law firm, you don't have to do everything in-house either. Just try and outsource it strategically and surround yourself with people that are doing it right and learn from them. And that's how over time we've been able to really become efficient in what we do.
And then, I mean, perfect segue. Are you nationwide?
Yeah.
Awesome.
Short answer. My only short answer of the day. Yes, 50 states.
And then another question, what is the typical cost of these services for the party?
Yeah, great. I'll tell you 80% of our cases, they don't go above $1,000 for transportation. Because a lot of times they're in like a metropolitan area and it's a pretty short ride, and we'll have to take them a couple times a month, or actually a couple times a week for multiple months. It gets expensive though. Let's just say you have somebody who lives like 40 miles away, or if they need a flight, or if they need wheelchair accessible transportation or something like that, those get more expensive over time. But we have a limit in place. We just stop at $1,000, and when we get close to the 1,000, we'll let the law firm know. It's like, hey, we're already getting close to 1,000. Do you want us to continue providing our services, or do you want to work something else out with your client? And that way, nobody's going to get sticker shock, and nobody's going to be upset that they used us on a case that really had, they already had a lot of medical damages on there. Maybe there's a pre-settlement funding loan out available, and this case is already upside down. So that's why we're really respectful with the healthcare providers and the law firms we work with. We're very mindful of case costs, and we try and keep a lid on it as best as we can. And with pharmacy, our bills are, I think, are under 1,000 most of the time anyways as well, with limits in place as well. Great question.
Awesome. And then the next one reads, I've been in a lot of situations where we educate our patients to go to their attorney to help them, and they say that the attorney doesn't even speak with them or help them. I'm assuming this kind of, goes in line with the physician telling the patient to ask the attorney or tell the attorney that they need transportation or anything like that. So yeah, how do you deal with that? Or how do you even educate the attorneys to be more responsive and look for these things for patients?
Great question. So we experience that all the time. I'm not going to name names here, but when you have a big law firm that has like 50 attorneys, their pre-lit department it's like Wolf of Wall Street type of, mentality. And it's so busy, so crazy, high turnover. I'm not about to go try and educate that whole department, considering half those people may not be there, 6 months from now. What we do in that case, and honestly in all cases, is if you're a healthcare provider in this space, just keep our business cards or our flyers in your office. And anytime you have a personal injury patient, just be like, hey, if you need help with your medications, or if you need a ride, just call these guys. So the patients call us and we coordinate with that attorney. So that way you don't really have to depend on the attorney to do anything. I like to talk with the attorneys, or we have a sales force that likes to educate the attorneys in the pre-litigation team, and we make every effort to do so. And we, of course, we like to inform healthcare providers of our service as well. But like you said, a lot of times communication isn't there or it falls through the wayside. So we always offer the ability for the patients just to contact us. They can be like, hey, I need a ride. I'm represented by this law firm. I need a ride. I don't have a ride there. Or I can't afford the medications that this doctor wrote. And my doctor gave me your card. They said, you can help. Can you really help me? And we're like, yeah, we have case managers on staff, multilingual, Spanish, English, Urdu, Vietnamese, Chinese. And then we have translation services. If it's outside of that, that will help your client get taken care of. So you don't have to feel like you have to depend on a law firm to do it. We're going to educate everyone. We educate healthcare providers, law firms, and clients.
Awesome. And then another question is, I'm sorry, I'm like, is this frequently reimbursed or is it typically taken out from the attorney and or physician? I'm assuming they mean they're
I love these questions. These are great questions. No, the reason why it's okay, no, yes, it is reimbursed. And here's why it is reimbursed. It's because we don't provide transportation or injury like medication coverage if it's not related to the injury. If I ever find out, like we like to always like test where the drop-off address is. If I see that the drop-off address is like a dry cleaners, we're just not going to provide that service. We're not like 100% foolproof. A lot of times we just provide the service and check afterwards, but we always let the client and the attorney know when you use us, you're only supposed to use us for appointments or transportation or medications related to the injury. That way, when we are deposed, and we do get deposed, we're able to confidently say, like, listen, we told both the healthcare provider, the law firm, and the client to use this only for injury-related, transportation and pharmacy, and our records show that as such. So to date, fingers crossed, none of our cases have been thrown out or our bills not been recovered because of that. And we have legal opinions in certain states where our own healthcare counsel opines that transportation related to the injury is compensable in personal injury judgments. So I know the majority of you guys are in California, but if there's anyone outside of California that has a question on their specific state, I encourage you to email me, and me and my healthcare counsel can look into it for you. Because I think we've done the legal opinions on at least like 15 states thus far.
Awesome. And then I think it's a great question. Can physicians blame the attorney for the gap in care, especially if they didn't get transportation provided? Many times doctors are blamed when it's not the case. I can only laugh at the question because my dad's a physician, so I get full reign to laugh and say,
no, I get that. It's like, well, I guess my question is like, man, this is like some husband-wife type stuff. It's like, well, yes, you could blame them, but what do you get out of it? Like, to me, I'm like, yeah, I blame you. You're the one who dropped the ball. And then my wife could be like, hey, I blame you for dropping the ball. The ball was dropped no matter what. So I agree. Yeah, you could blame them. They may blame you. They'd be like, hey, it's your appointment. You should have figured it out anyways. Well, thankfully there's a company like me where hopefully this won't happen that often. But at the end of the day, there is no like blame, like, hey, it's solely in your, it's solely in your purview or not. That's why I encourage everyone on both sides. If you notice, those two slides that were takeaways was, if you're a law firm in case intake, ask these questions. If you're a healthcare provider during scheduling your patient appointment, ask these questions. So at least one side will end up figuring out who needs a ride, and how you guys schedule it with me or without me doesn't matter. Prevent that gap in treatment. And hopefully upon the person leaving, make sure they have what they need for any other part of the case that they might be involved in. Because if they're missing somebody else's appointments or not taking medications from another doctor that's involved in the case, don't be like, oh, that's not my problem. I don't need to worry about that. That's that other doctor's problem. It's everyone's getting paid out of the same case. So just try and think about it that way. It doesn't really take much for you guys just to educate your client on what any solutions they have out there. I'm just one of the many probably solutions you guys have for your clients, but just some communication to go a long way. And if you guys are really like strapped with time and things like that, and it's like, oh my God, my staff's so busy, I don't have time to ask this stuff, well, then just print it on in a piece of paper and include in your workflow just as a paper to give to them on their way out.
That is actually the next question. They said, do you have a form that can be provided for patients to fill out with those questions so they can pass it along to the attorneys to cover their bases?
Yeah. Again, and after this, maybe you can email it out. Just those 3 questions. I make it so simple. Like, however you get that to your client to get the answer from them, whether you have an email campaign, whether you're a small office and you just want to print it out on a Word document, or you want to laminate it and then just point to it during checkout, be like, hey, do any of these apply to you? Well, then you know, right? If they don't apply, it's like, oh no, I got prescription coverage. Oh no, my wife can take me to the appointment. We're like, okay, cool. Don't need to do it. So however you want to integrate it within your workflow, you don't need something high tech. You don't need to just add it on to your checkout assistance or whatever your case intakes. You know, they have so much stuff to do. However you implement it, it's up to you. But it's just 3 questions. And if you don't want to use all the questions, edit them how you see fit. It's just a suggestion at the end of the day. All I'm trying to do is, you know, hopefully prevent issues between you and the other, you know, companies that you work with. And of course, make sure your clients get better and they don't deteriorate during the, you know, pendency of their legal actions.
And then the last question for right now that's come in is, can you post your business info before you log off? I don't know if that was on one of your slides, so people can just easily take a screenshot. That's always the best method. And then also I'll be sure to post the information within the membership portal underneath the recording with materials as well.
Cool. You know what I'm gonna do right now, everyone? I'm gonna just give you my personal email because compliant. I don't want you to talk with my sales team or anything like that. I mean, I do want you to talk to them, but in case you have something directly from me, that's my email. And here, Dr. Survam Patel, and I'll give you the website here. So in case you guys want to save it, I'm in Austin, Texas, so I'm in Central Time, 2 hours ahead of you guys. But honestly, I feel like in California because all you guys keep on moving over here. You guys have traded in high income tax for high temperatures. So 2 of my neighbors are from California, but I'm more than happy to talk with you guys whenever you guys need me. And yeah, I'm more than happy to help you guys out wherever I can. Even though I'm limited in the personal injury space, I do have a couple of companies that are not in the personal injury space. This is not the only thing I do. I have a company in the veterinary space. We have something in dermatology, something in supplements. If you just want to bounce some ideas off each other or, you know, anything I can do to help anyone out, please reach out to me.
Yeah, and I mean, it already sounds like we're going to need another webinar scheduled on the books with all the questions. And I know there's going to be more to come from the recordings and everything. So I think that this is definitely something that needs to be talked about more because like you said in the beginning, it's so obvious everyone knows about gaps in care, but they don't talk about it or how to avoid it or even think about these little details like their patient. I know even personally with our own clinic, sometimes we get frustrated, like, okay, well, why was there so many no-shows on this day? Or like, you know, something like that. And it's a question that, you know, physicians need to ask themselves, okay, if there's all these no-shows, is there, you know, a transportation issue and should that be brought up with our patients? And then attorneys should be doing that as well, seeing like, okay, if all of our clients are not showing up to their like appointments, maybe there is an issue with transportation. Yeah, like you were saying, it's just not talked about enough. So let's put it on the table and talk about it. That's the end goal.
Just raise awareness, you know, maybe they're missing points for other reasons, you know, it might be out of your control or my control. But if it is in our control to prevent them from missing appointments, let's do what we can and everyone will benefit from the outcome of that, especially the patients, because hopefully they're going to get better quicker.
Awesome. And then we do have a few more people asking for email address, so I'm just copying that over to them. So I'm sorry if
Cool.
All right. I'll also just post it publicly for everyone to see in case they missed it, along with the.
And again, if you miss anything I said, if anyone, I know I speak really fast. Usually I'm a lot slower if we have one-on-one calls, but I wanted to make sure to get through everything on a webinar. So just if you want to go over anything one-on-one and things like that, I can always, after you email me, I'll send you my Calendly link. And if you or anyone else in your firm or your healthcare practice want to have a time for a meeting, we can always block out time. And I promise you, I will try my best and talk much slower that day.
No, you did a great job. And I'm super grateful that you were on and thank you again for your time. I know everyone's super happy. I know when there's tons of questions and it's tons of dialogue, then it's really, you know, it's resonating with people and that's the whole purpose behind that. So really grateful to have you on and hopefully on again soon. And yes, thank you everyone and happy Tuesday. And yeah, hope you have a great rest of your week. And for those that are CSIMS members and we're hoping to tune into our advocacy webinar tonight, it did get moved to next week. So please check the community messaging board for more information. And with that, thank you again and have a happy Tuesday, everyone.
Thank you everyone for your time. Thank you, CSIMS.
Yep.
Bye.